better response, and better prevention. For each of these three things, the Global Health Security Agenda has detailed, measurable, what we like to call failable metrics. It's not about health for all. It's about a very specific, measurable agenda that will result in core capacities that are consistent with the international health regulations of the World Health Organization and will allow countries to address health threats that are of greatest import to them. I think of dividing the world into three parts. There are the OECD countries, which need to make sure that their own houses are in order and that they help the low-income countries. There are low-income countries that need to commit resources and prioritize this area, but need assistance, technical and financial. And there are the middle-income countries, which at a minimum should keep their own houses in order, and we hope and are increasingly seeing them work in a South-South collaboration with other countries to strengthen those core capacities of prevention, detection, and response. I'll call out Peru because they volunteered to be one of the first countries to undergo an independent, objective assessment of their level of preparedness. One of the challenges with the international health regulations is that it is a self-assessment. And the global health security work envisages an independent, objective, transparent, public assessment of preparedness. And if that's present, we think that will result in an incentive for countries to do better and a pathway or guide for donors and OECD countries which want to help countries to figure out where they need to provide the most assistance.
Can you say a bit about, last night when we were talking with President Moreno, the Inter-American Development Bank is 20% of its resources. A dramatic amount of money goes into health. And he talked about investing in readiness, and he mentioned specifically about dengue and chikungunya. And he talked about the sense of vulnerability. So I took that as a pretty strong signal that the partner countries themselves, who are the key members, who are the core members, that these sovereign states themselves have embraced this concept of readiness that aligns very closely with this. That yes, Peru stepped forward and become active in the self-referencing and the self-assessments, but it's much bigger than that too. Can you say a bit more, like what would you anticipate looking out over the next few years? I mean, these threats are episodic. They come and they go. They're difficult to predict. Your efforts are to get people to lock into a sustained, significant commitment to build these capacities. That's partly what we heard from President Moreno last night, was that this is already something that has risen to be a priority in the lending practices that reflect these sovereign states. What do you see?
There's been so much interest and attention in health care. The issue of public health is generally not as well understood, and there's not as much attention to it. But the public health capacity is crucial, and that means laboratory networks. That means competent laboratories. It means epidemiologists or disease detectives who can investigate outbreaks. And optimally, that's done through a national public health institution. Something like Fiocruz in Brazil, a very, very strong organization in Brazil that has functions that actually are overlapping with CDC, but in some ways broader than US CDC. We're working with the Caribbean and with Guatemala to try to establish national or regional public health institutes there. Fundamentally, if you want to upgrade the capacity of the country to improve their health status, you need to have data to drive it. And that data is going to come from public health surveillance systems, it's going to come from laboratory networks, it's going to come from intensive analysis that is done not ignoring the healthcare system, but on a different plane than the healthcare system, thinking of public health more broadly. Now, interestingly, Latin America has a history of publicly funded healthcare that may allow it to more easily expand the public health efforts. And there are many parts of Latin America that have very strong public health systems to further build on or share regional capacities.
Thank you. Why don't we invite a few comments, very brief comments and questions. There's a microphone here. There's another one over here on this side. If anyone cares to jump up and offer any comments or questions, just please identify yourself and please be very succinct. Thank you.
Good morning, Dr. Frieden. It's a pleasure to be in your company. Jesse Milan from Dory Underwood and the Black AIDS Institute. You've talked a lot about international security, but I realize that the FDA does not fall under your purview, sir, but could you give a comment around food security, especially for so many importations coming from Latin America to the United States?
So the question is about food security. We get about 80% of our seafood from other countries. We get a large and increasing proportion of our fruit and vegetables from other countries. So improving the regulatory capacity of other countries is very important, but also improving the disease detection capacity is important. So identifying outbreaks of diarrheal disease or other food poisoning, this is in our self-interest. It's in our self-interest to ensure that countries that we do business with have improved systems to find, stop, and prevent the spread of disease. As an epidemic intelligence service officer, I investigated an outbreak of what turned out to be essentially traveler's diarrhea, which was contracted by a large consulting firm in Manhattan based on some shrimp that were purchased from a provider in the Gulf of Mexico. It's a very globalized world food supply, and improving the quality and safety of it anywhere is ultimately going to improve productivity everywhere.
Yes?
I'm a physician at Emory. Also tried to write books to empower people. We had written Doc Hollywood, and one of the things I have wondered is, and this is a problem around the world, is to, in education, not just teach reading and writing, but teach and empower people to be better health consumers. In other words, we worked with the CDC on the kids' book on immunizations or symptoms that are life-threatening, so people know that. When I worked in emergency rooms, even in this country, people would come in too late and they'd be dead, and they didn't know the signs of meningitis. And I wonder if it's possible that we can even donate books that are in Spanish that relate to these topics. But it would be great if this could be a movement to start to empower people and teach them some of the stuff we learn in medical school.
Thank you.
Thank you. I think with increasing literacy, with increasing education, there's a tremendous potential for people to take more control of their own health. Part of what we do in public health is to try to make that information readily available to people so people can make more informed choices, but also to change what's sometimes called the choice architecture, so that when you go about your business and do things that are the default value, you end up healthy rather than sick. That includes drinking water from the tap and not getting sick from it, or doing other things that are just normal course of business, and being able to do that without risking illness. That's fundamentally what public health is about.
Yes?
I'm Tom Watkins, freelance writer. What should have been done differently in responding to the Ebola outbreak?
The first issue on Ebola was that we didn't have in place systems in West Africa to find it quickly. That was the first and most important problem. If you compare what happened in West Africa to what has happened in the past couple of years in Uganda and DRC, there are outbreaks of Ebola because we've trained staff, because we've trained hospital workers, established laboratories, established response capacity. They're rapidly identified and stopped before they spread. If you look at what happened in Nigeria, it's very instructive. A single traveler from Liberia went to Lagos, Nigeria, a city that has about as many people as all of the 3 countries of West Africa combined. There was an outbreak of Ebola because it wasn't immediately recognized. We immediately immediately swung into action, and we deployed the polio eradication infrastructure for Ebola response, established an emergency operations center, put an incident manager who was experienced in managing emergencies in place, flew in a large team of CDC staff, redeployed staff from the polio eradication effort to the Ebola response. Over the next couple of weeks, that group in Lagos identified more than 800 contacts, did over 19,000 home visits, identified 19 secondary cases in 3 different generations of spread, but stopped the outbreak. If that hadn't happened, the past year could have looked very, very different. Ebola could have gotten completely out of control in Lagos and spread throughout Nigeria and Africa. So that core issue of strengthening the capacity of countries around the world is critically important. And then where that isn't sufficient, the ability to surge in is important. At CDC, we activated our Emergency Operations Center for Ebola on July 9th, and we committed to putting 50 of our top disease detectives and disease control specialists into the field by the end of the month. Things moved so quickly that we had hit that 50 mark within 11 days, and by the end of the month we had 100 people in the field in West Africa, but it wasn't enough. The global need to surge in was just greater than CDC or any other organization was able to do at that time.
Do you agree with the criticism of World Health Organization as putting out what some call a lackluster response? Do you agree with the criticism of WHO for a lackluster response?
I think no organization can look back on the past year of dealing with Ebola and say we did everything right. Clearly there were serious problems with how the WHO responded initially. I think that just re-emphasizes the need we have to strengthen WHO, because it is the organization that has the mandate and should be able to do a lot of the things. There are some potential mechanisms where WHO can coordinate others. There's a global outbreak and response network that has hundreds of organizations. That network, if more vibrant and effective, we think could have been much more impactful in this situation.
Thank you. We'll take one final question, Ginger.
Thank you, Dr. Frieden, for coming. Ginger Floyd, the Morehouse School of Medicine. And it's a follow-up to Dr. Shulman's question in terms of the use of traditional healers, frontline workers, community health workers in these programs that are affecting us around the globe, whether they be curandanos in Mexico or, candomblé in Brazil, and traditional healers in Africa. How do you believe that these are, many people believe these are the right messengers. How do we ensure they get the right message? And how do we use them?
One of the really promising practices from Latin America that has been adapted in the U.S. is the use of promotores de salud, or health promoters. There's a lot of evidence and experience about what works and doesn't work in community health workers. It's not enough to be well-intentioned. It's not enough to hire the right people. You have to ensure that community health workers are integrally involved in and part of the primary healthcare system. If they're not going to be effective. They won't be supported, they won't be trained, they won't have backup, they won't be trusted by the community, and won't be able to function effectively. If they are, it extends the reach of the primary healthcare system into the community in a way that may be culturally acceptable and much more effective than some of the clinic-based services. I think in this and in other areas, to just make a final comment, there are so many areas where Latin America and the Caribbean have promising practices, best practices, real progress, where we can both extend that throughout the hemisphere, but also extend that into new problems, strengthen our security against global health threats, further improve vaccination programs, extend to new vaccine introduction, address the cancer, heart disease, and stroke problems that are now our leading causes of death, and also are amenable to public health approaches of high-quality, standardized, accessible care. And that's the kind of progress that I think we can look forward to in the coming years in Latin America and the Caribbean.
Tom, last night there was a lot of discussion around what does the potential normalization of relations between the United States and Cuba mean in this broader question around capacities? And setting aside for a moment the complexities of getting from point A to point B, what would you see as the benefits and consequences downstream if the politics and some of the legislative barriers are resolved? What might that mean in your view?
Cuba has an interesting public health system. It is unique in many ways in the world. It relies very heavily on physicians and on community-based care. I haven't studied it in detail, but I've looked at some of the results. There are also remarkable implications of the economic difficulties that Cuba has had. For example, when the nutritional status of the Cuban people went down, you saw epidemics and a big increase in tuberculosis. But the country has been able to turn out large numbers of doctors and to provide those doctors as a form of international solidarity. I traveled recently to Koya, a community in Guinea, where the Cuban doctors were staffing a Ebola treatment unit constructed with U.S. taxpayer dollars and operated under the World Health Organization and African Union auspices. And I got to chat with the Cuban doctors and see what they were doing. They were so proud of being able to contribute to the response. Cuba also has its own health challenges, as does the U.S. and every country in the hemisphere. And the more we can share what's working and what's not, the more all of us can make progress.
Please join me in thanking Dr. Frieden.